Hey everyone, Dr. FJ here with Gardner Schofield Chiropractic. I want to talk about TMJ problems, jaw pain, and NUCCA. So TMJ problems typically manifest themselves with jaw pain. So just pain on the jaw, usually one side, but it can be both. You also many times will have a popping or clicking noise when you're talking or chewing. And most of the time it's not a problem with the actual jaw. It's a problem with the head and neck positioning. You can imagine if you tilt your head way over and you open and close your jaw, it's not as easy than if your head's straight up. Okay, you can feel the tension. And so if your head and neck are out of alignment, then it can definitely affect how that joint is moving and create a lot of pain. There was a study done in 2012 on 5 patients with jaw pain, and they had one NUCCA correction, and their pain went from almost a 6, 5.9 out of 10, so pretty severe, to 0.9, so 1 out of 10, almost nothing off one correction. And then atlas bone is located right, well, for most people, right behind the jaw joint. Right behind that TMJ joint is the atlas. So it's very, very close. When that goes out of position, one, like I was saying, the head and neck positioning can affect how the joint is actually moving. I have a patient, and when her bite is off, she's a dental hygienist, so she's obviously really knowledgeable, but she knows when her bite is off, she needs to come in and get adjusted. And after we adjust her, her body settles into alignment. The bite normalizes. It's incredible. But we have, tons and tons of people that come in for neck pain, headaches, and they so many times also have jaw pain, and it goes away almost every time when you get that head and neck positioning. Sometimes you got to work on the muscles themselves and do some soft tissue work, but so many times just fixing that alignment and the jaw pain gets much, much better. You can also have nerve pressure with that stretching of the nerve usually. It's not usually pinching, and that can cause referred pain to the jaw and also just the muscles. If they're chronically out of alignment for so many years, the muscles can get spasm and you can get a lot of contraction, and that can create a lot of pain as well. So there's several different ways where the head and neck being out of alignment, or what we call in chiropractic a subluxation, how that can create jaw pain in TMJ. So now Maggie is a good friend of my wife and a patient, originally came in to me for neck pain, and then she was having jaw pain, so she came back in, and she's going to tell her story up right now. Hey everyone, Dr. FJ here with my wife's good family friend Maggie. She's going to tell her story and experience with NUCCA.
Yes. So I came in and I was having issues with my jaw, and I really wasn't sure where it was coming from. I just woke up one day and was having some pretty substantial pain in my jaw, and I thought I would call FJ and see if he had any ideas or solutions on what could be causing it. And I came in and he did a couple adjustments, and then after that I haven't had any issues since.
Awesome. Well, thanks for sharing.
Yeah.
So as you can see, for Maggie, the change was quick. Within a few hours, her jaw pain started getting much, much better. And then within a day or two, it was completely gone. Now, I don't want everyone to think that that's what's going to happen to them right away. If the problem's been going on a really long time, it may take a while for those tissues to heal. She had already been in our office years before for neck pain, and we had fixed that. And then she had gone out of alignment, and then her body was manifesting that misalignment with jaw pain this time instead of neck pain. That happens quite a bit. Sometimes the misalignment will cause different symptoms. So if you're having jaw pain, TMJ issues of any kind, I'd recommend you find a NUCCA chiropractor or an upper cervical specific chiropractor of some kind. Orthospinology, AO, Blair. You'll know they're upper cervical specific because you'll be sitting in a chair with head clamps when they x-ray you. That way the x-rays are super, super precise. They'll do an analysis, then they'll adjust you, and then they'll check you after to make sure the body has received the adjustment and your body's been fixed. And then you'll hear a term called holding, which only upper cervical specific chiropractors talk about, where you'll get checked and you won't get adjusted because your body will be in alignment. And that's ultimately the goal, to get you where you're in alignment and you don't need to get adjusted, and then you can go long periods without being seen and your body heals. Holding is healing. So if you don't maintain that alignment, those tissues will never heal. So it's a little different concept than traditional chiropractic. So if you're having those issues or a family member, check it out. Find a NUCCA chiropractor or someone that does upper cervical specific chiropractic, and it could change your life. This is Dr. FJ reminding you that health's not a matter of chance, it's a matter of choice. So choose wisely, my friends.